Good morning, everybody, and thank you very much for the invitation to open today's seminar, which is really all about advancing the tobacco-free agenda and bringing it to the next level. And I suppose being very cognizant of some of the inherent inequalities in the current kind of coverage of our tobacco-free policies and services to those people who are most at risk. And before I go on to talk a little bit more about that very briefly, I really thought in looking through today's agenda, and thank you to Mike for coming all the way from England, and to all the people here across the various different kind of services within the HSE, particularly to our colleagues who might be coming to this agenda for the first time from a mental health or disability or older person services perspective. But I thought it was really important for us to actually acknowledge where we are now and what we've achieved as a health service and as an organisation through the Tobacco Control Framework Implementation Group on this agenda. And I think that it's important for us to genuinely reflect on those successes that have been delivered during a very difficult period for all of us, where there has been a moratorium on recruitment, where we have far less staff working within our services, where promotional opportunities have been few. And I think that it's important for us to reflect that an awful lot of the successes on this agenda to date have been delivered in that context. And that's really important for us to kind of to take some time out to reflect on it. The Tobacco Control Framework Implementation Group, which has representations across the divisions of the HSE, and in particular over the last number of years, the acute side of the organisation and the primary care side of the organisation have been very important in this, given that they were the kind of priority areas. And more recently, obviously, there's going to be a significant focus on mental health and older persons and disability. But there has been significant leadership across the organisation from all of our staff, both management and people working within our services, to drive out the tobacco-free hospital campus policy, extending it into primary care settings. We have significantly improved our performance indicators around our cessation services, and there's an intent to improve them even better, looking at kind of outcomes. There has been a much more methodical and sophisticated approach taken to the training that is happening in relation to brief intervention for our staff, and very, very positive feedback coming back from that. We have an award-winning communications campaign, quit.ie, and not just any award. It recently won 2 AdFX awards, as people here close to the Tobacco Control Framework Implementation Group would be aware of, and that is no mean feat. That's where our campaigns are up against all of the campaigns of the private sector, and particularly winning in a category for long-term effectiveness and impact is really a truly great achievement for that campaign. And we all know of the bottom-up approach that was taken in terms of listening to people who are seeking support through our Facebook page, and the work of the real people kind of featuring in our campaigns, culminating in the piece with the late Jerry Collins and his family. We have a very, very impressive regulatory environment through our Environmental Health Service. And one of the most recent figures I saw was 97% compliance with the workplace ban. And we also have Drive. So looking at some of the work that is happening this year, we have a big project ongoing to integrate our smoking cessation services into a one-stop shop kind of interactive streamlined quit service, which is going to be launched very soon. And certainly from talking to public health leaders recently in Scotland, I mean, they were very interested to hear about our work and what we're doing within the health system. And we know that the smoking ban in Ireland had a significant impact internationally, with a number of countries following suit. And I think that we can do the same with this agenda that we're talking about here today. So in terms of the sort of next steps and bringing ourselves onto the next level and extending our goals and taking serious steps towards changing attitudes towards smoking within mental health and older persons settings and disability services, it's really important, I think, that this particular challenge that we will have and that we're up for, that we take it very seriously. When I left college as a psychology kind of graduate, I went to work in London for a couple of years, and I spent the first year working as an auxiliary nurse in various psychiatric institutions and older persons' homes around London, some kind of palliative care as well, but mainly it was in psychiatric hospitals and in older persons' homes. And it was very remarkable, particularly in the psychiatric settings, the pervasive kind of smoking kind of culture amongst patients, and indeed amongst staff actually to an extent, but particularly amongst patients. And I suppose now, in terms of the role that I have and the work that I'm familiar with, it really is, it really is borne out by the evidence, where we know that people with severe mental illnesses die between 15 and 25 years younger than the rest of the population. And 2/3 of that can be attributed to cardiovascular, pulmonary and infectious diseases. And we know that people with mental health problems live a more sedentary life. We know they're 5 times more likely to smoke heavily. We know they're twice more likely to get type 2 diabetes. At the mental health division's kind of think-in last November, I made a presentation on the physical health needs of people with mental health problems, and we committed to engaging in more research in the Irish setting, because an awful lot of the data that we looked at for that presentation really came from England and the rest of the UK. But we know that smoking explains most of the excess mortality in people with mental health problems, and that's something that we have to take very, very seriously. When we look at the prevalence of chronic diseases, we know that depression is going to be one of the leading causes of chronic disease by 2030 when you look at the literature. So it really is something that internationally and indeed nationally we have to take very seriously. And the same can be said, of course, for our older person services. I mean, there's a whole swathe of clinical literature there around the merits of smoking cessation and its impact on survivorship from cancer and the reduction in kind of comorbid chronic conditions and so on and so forth. And again, for our staff working within these settings and for the people availing of those services, this is a really, really important issue. And just because we've had successes, particularly as an organisation, in pulling together and in trying to deliver in partnership a kind of a consistent and coherent approach to tobacco control, I mean, the burden is still a really big one. We still have 5,200 people dying every year from smoking-related illnesses. We still have 1 million people smoking tobacco products. So we have to make sure that we maintain the successes of our policies and our services to date whilst also driving them further. And we know, and the people working on the ground, that the way we do that is we need to have leadership right through the system, top down, bottom up, and we also have to do it in partnership. And of course we have a mandate. We have Healthy Ireland and we have the Tobacco Free Ireland policy. And they provide a mandate for us to deliver on this work into the future. Tobacco Free Ireland having a commitment to reducing smoking levels in Ireland to under 5% by 2025, which is very ambitious. But when you look at the work that the divisions and the people working with the Tobacco Free Framework Implementation Group and people actually working within the settings, they too are ambitious. So I would like to thank you for inviting me to open today. I'd like to wish you the very best of luck with today's workshops and seminars, and people, wholly kind of contributing to what the kind of vision can be, but what the obstacles will inevitably be in terms of getting there, and how we can work collectively towards addressing them. This is the start of something that I hope in kind of months to come, again, we'll be able to reflect back and look at our successes again into the future. So thank you very much and good luck with the day.